In our first story, peace is gradually returning to Agbogloshi here in Accra, where 3 weeks after clashes there left 2 people dead and some wounded. There's still police presence in the area, and business at the yam market is yet to resume. However, some of the residents whose houses were destroyed say they cannot rebuild because of threats to further attacks. Manasseh Azure Awone has been to the community and now reports.
At the Konkoma Yam Market at Agbogloshi, it is business as usual. The young women are selling as truck pushers who are competing with head porters cut hundreds of tubers from the market. Apart from the heavy police presence in this area, it is difficult to imagine that this market was closed to business 3 weeks ago due to violence. The clashes interrupted business activities. The business is back now, but deep inside the settlement, the wounds of destruction caused by the violence are yet to heal. The structures and shops that were either looted or vandalized are yet to be put back into business. The head of the Konkoma Yam Market Association, Ezekiel Dana, says the owners of the structures are still away. He says some criminal elements have taken advantage of the situation, and until they are dealt with, there will not be peace.
We have been here for over 30 years now. Since here was small, there used not to be this an easy thing. But now that we have found out that some criminals has infiltrated into our midst who want to cause confusion, and therefore we are urging the government, to put feet on the ground, and all who are suspects, the police are here. At least they have gotten some names and know maybe if they have gotten wing of others, at least should help us weed out those partners who always want us these clashes to carry on, for they have their agenda.
Joy News sources meanwhile say the police are meeting leaders of the communities on Wednesday to dialogue on how to bring lasting peace to what has become the biggest slum in the country. Among the steps to be taken is the creation of a neighborhood watchdog committee made up of members of the various groups in the area. This move, according to Joy News sources, has been sanctioned by the Inspector General of Police, David Asante Pietu.
To provide health care which is more patient-centered, accessible and safe, the Ministry of Health has identified gaps in the health system that needs proper attention in order to improve the overall quality of health delivery. The key areas include maternal and child health, mental health and geriatric health. Well, Patricia Gasu has more in the following report.
Quality healthcare delivery is essential and key to the socio-economic development of any country. Though unequal service abounds in the health sector, stakeholders want to ensure at least all patients receive the right care at the right time in the right setting every time.
There are standards that the professionals are supposed to adhere to in delivering care. When you come in with malaria, we know the questions that are supposed to be asked. We know the examination that you're supposed to undergo. We know the lab tests that are supposed to be requested. We know even the communication that has to take place between the health professional and the patient. So what we want to ensure is that all of these things are being done reliably all the time in priority areas. So if you read the quality strategy, for example, we have a number of priority areas: maternal, newborn and child health. And we have focused on areas where we have gaps. So over the last 10 years or so, if you look at maternal mortality is reduced by up to about 50%. If you look at child health, the last demographic and health survey reduced by about 25%. That was done in 2014. But there is an area with the newborn care. And the newborn, I mean the first 28 days of life, where we are not seeing that much of a significant improvement. So there's clearly a gap there. And I say there's a gap because the women are getting pregnant, they are doing antenatal care, they are delivering in the facilities, the figures are going up. Postnatal care, in terms of coming to the facilities after delivering, their figures are also going up. So in terms of the quality of this care that is provided at the time of labor, I think there are question marks about it that we will need to address.
The Ministry of Health, in collaboration with other partners, has taken steps to engage patient groups and consumer protection groups in soliciting their views to drive a quality healthcare delivery system in Ghana.
Often we hear all kinds of complaints in the media from patients, they are not happy with one thing or the other, talking about the fact that they spent a long time waiting. Sometimes health professionals themselves have complained about quality of medicines that are given to patients. Patients spend a lot of money, but then the cure is not coming as much as you want. I mean, these are all quality gaps. And the attempt is to bring patients also into the conversation so that it's no longer health professionals telling patients what should constitute quality. But even the very definition of quality is looking at patient satisfaction, meeting the patient's expectations.
Executive Director of Ubora Institute, Ernest Kanyoye, believes investment in the health sector will improve and sustain the campaign.
One of the things we ought to do is to be able to advocate, campaign, and make sure that every stakeholder who can put in money, who can put in resources, who can put in time and energy would feed into that. So we are going to present a cost plan to all the agencies, and then most likely what is going to be sustainable for us, because we want to create a sustained, improved healthcare system, is that government or policymakers begin to devote a lot of money or budgets for areas around quality, because that is what is more sustainable. Taxpayers' money in terms of funding things is more sustainable, but of course it should be applied judiciously. So sometimes quality is not about how much you spend, it's about how well you spend.
The 4-day discussion is intended to develop an action plan and to outline the way forward for agencies in alignment with the National Healthcare Quality Strategy.
Away from health, the Ghana Real Estate Association is backing calls for social housing fully funded by government, and this is part of necessary reforms in housing. The real estate developers say that is the effective way to cater for about 25% of Ghanaians who are homeless. President Akufo-Addo has already likened Ghana's housing situation to congestions in the prisons. And the acting executive director for the Ghana Real Estate Association, Samuel Amagayibo, said the research has shown that only 13% of the population can afford housing, hence the urgent need for social housing. He was speaking on the Pulse with Gifty Androapia.
We can see where other countries have adopted that every land in the country belongs to somebody, but then the administration of land is solely managed by the state. The state cannot sell land to more than 2 people at the same time. First of all, the thing has to be properly documented, and then we can have a software system that picks up each land. Okay. And then when sale is done, it is done one transaction. So anybody in this country who owns land cannot sell land on your own unless you pass it through the state. For social housing, I think government has to take that responsibility. We did some study that we're trying to look at the purchasing power of Ghanaians, and that study gave out that it's only about 13% or so, 13 to 15% of Ghanaians who have the purchasing power to buy house. Okay, to actually buy house or build houses, buy houses. And then we had about 60% that had the capability of renting. They could afford rental. At some reasonable prices, they could afford rental. Then we had about, I think, 25 or so who did not have any capacity to either own, build, or do anything. So those people are the people that the social housing are supposed to help. It is everywhere in the world. We have the vulnerable. We have people, no matter how much you try, they will be there, and you need to assist them. And that is where social housing comes in. And that one has to be taken up fully by government. Maybe the private sector can partner government in a way to do something about it. But I think government must take that responsibility on its head, and then can get private sector to assist them to do it.
Meanwhile, the Ghana Prison Service says the country is at high risk if the housing situation of both inmates and prison workers do not improve. He cites the influence of hardened criminals on minor offenders and the inability of prison officers to respond appropriately during emergencies as part of the risk facing Ghana if housing needs of the prison service remain the same. The service is seeking private partnerships to improve their lot, as landlords have been on their heels ever since.
We have a prisoner population of 13,000 plus and a prison capacity of about 9,000. So overcrowded by 32%. Skills to come out with as a better citizen. That means that the risk is so high. And instead of being at a place that will just give you the time to reflect and get back and not repeat same, you are now in the midst of very hardened criminals, and they can impart some knowledge of criminality into you. And you are coming back, you are bringing that back to society. That is a huge risk.
That is, wow.
And it's not for nothing you put men in uniform at the barracks. In the event that there's a problem in any of the prisons, you can easily mobilize them to take control, to take command. But we are far away because of lack of accommodation. That's a risk. And your privacy is not assured. I mean, you are an adult male with adult children squeezed in a cubicle. That affects your psychology as an officer. It affects your work output. We are thinking of a PPP project that we can use people who want to come in to support us. We have the lands that are there. It was even in the news. In Secondly, we had a problem with our landlords. They went to lock the places because of lack of funding for us to pay. In WA, we had similar problems. So there's a problem. The issue is that with the PPP, it won't just take a day.
It will take some time.
It takes some time.
So what is the immediate solution?
The immediate solution now is for government to push to have us get accommodation by whatever means, whether it's through PPP or government solely funding it. That should be the immediate solution, because we are really tight.
The National Union of Tenants Ghana say they are poised to hold the Akufo-Addo administration to its promise to provide social housing. The group, disappointed by successive government's lack of enforcement of rent legislation, say they will work to influence vote against the NPP if they do not fulfill their promises. Here is its secretary, Frederick Opoku.
Politicians.
Okay.
Since 1992, 2000, let's say from 2000 to date, 16 years down the line. Go and also what from what Professor Mel said, what John Mahama said, and what Nanado said, and even half of President Kufuor. But he tried to walk the talk.
He started something.
At least he tried to walk the talk.
Okay.
And at least came out with something. Unfortunately, the commitment to finish was not there. And that's what we think, that government or politicians are not emphasizing, are not doing much to practicalize what they say. The time has passed whereby politicians just come to occupy space in their manifestos and say whatever, and they go with impunity. Because after all, people don't look up to housing. If it's about education, fine. If it's about health, fine. But this time around, trust me, my sister, housing is going to be center point of discussion in this country. That if care is not taken, we are going to ensure that as many people as we can convince and influence to vote in a certain direction. If you're not going by it, we have to vote against you, because more than 11 million people are suffering.
In order to survive, some children at Myocho, a town in Pram, are engaged in quarrying. And these children, age 18, are forced to join their parents at the quarry sites because that is their only source of income.
These children, after school, rush to the quarry sites to help with activities, and this exposes them to danger. The children are made to crack big stones with a hammer. Speaking to Joy News, the children revealed they have no option but to support their parents.
When we were staying with our mother is also doing this job. When she died, and they said we should come and stay with our auntie. Our auntie is also doing this job, and they said we should come and stay with her and help her so that she can also help us to go to the school. If like we help her, she will use the money to feed us, and she also use some to pay our school fees. We come here like 6 o'clock, but if we come, we will start the work like 7 o'clock, then we will close 4:30. Like sometimes if you are cracking the stone and you don't take care, you use the hammer to hit your hand. And sometimes too, if like you are going to collect the stones, sometimes your back. Maybe if the government can change the job for our parents, like them to do, get good job to do. If our parents are doing good job, they will not allow us to come and do this job.
It's my parents who are doing it, and me come to help them on vacations, and sometimes after school. We close 3 o'clock, and maybe by the time I'll go home and change, it will be 3:30 or then I come. Sometimes if you are breaking it, you get hurt.
They further revealed the challenges they face at school.
Sometimes we don't close early, so if we go home, maybe if they are cooking too, you have to be helping them. So by the time they will finish cooking, maybe it's late. So sometimes too, I'll be tired and maybe I'll not be able to learn and go to bed. That been affecting me.
Mother of one of the children, Madam Esther, explains why her child has to be in the quarry.
Start at 6 o'clock.
We start work at 6 a.m. and close in the evening at 5:30 p.m. If someone is going to build a house, the person comes to buy the stones. The children help us so we can get enough income to enroll them at school.
They are appealing to government and other NGOs to come to their aid so they focus well in building their future.
I think we should stop. And maybe they can get a job for our parents to be doing it. That they can use it to take care of us.
Josephine Biama Asante reporting for Joy News.
Well, that's it for the news. Just in case you want to get interactive, please make sure you log on to our Facebook page. We're streaming there live, Joy News on TV, and please touch base with our Twitter handle at Joy News on TV.